very much for joining me here today on Code 254. My name is Amos Ogweri. Today I'm asking a question about prostate cancer. And the question that I'm asking, are people aware of the disease? Let's find out the opinions of people here in the street.
Man, I'm sure if you ask about 10 men around here, like maybe only one will know about prostate cancer. Because of the awareness, there's no awareness actually, and it's actually ignored. People actually think of cancer like labda watu fikiria ni disease ya masonko per se, you know.
And are not that aware about this prostate cancer. If we take an example of what women do, they sensitize everything about women, apart the STIs and all those stuff, which is not done to the men's side.
Ukweli hata mimi mwenyewe kwa binafsi nimehudhuria washa kadhaa ambazo zinahusu mambo hayo ya kansa, na hii vitu kujua vizuri kabisa inategemea the levels of exposure, kiwango cha ufahamu ambao mtu wako nao. Unajua kuna watu hata hiyo kansa yenyewe ukimwambia ni nini ajui, you just hears. Lakini as the government continue to sensitize people, Ministry of Health, various departments, various aid agencies, donor agencies katika sekta ya afya, ikiendelea kupush sensitization further, hii kansa itakuwa curtailed, itacontainiwa, itapunguka kwa kiasi fulani ile kuadhiri na adhiri watu. The main thing is just to get people exposed na wapate ile knowledge.
Wengine unaweza kuwa wanajua na wengine wajui. So inatakanga kwa muda tu hii history kiendelea, mwingine anafunzwa, wanafunzwa, ikiendelea bado inafunzwa, watu wanakumbushwa pia. Unapata pengine hiyo kitu iko kwa mbali. Unajua sasa ni hiyo kitu inapokuja ndio mtu anakumbuka haya. Imehappen hivi. Hii kitu inaendanga aje? Hii kitu inafaa kufurushishwa aje? So inabidi tu wanakumbushwa tu, wanaambiwa wajichunge na wajitunze pia.
Men are ignorant because personally I'm a man, but you know, most prostate cancer comes from eating maybe roasted meat and alcohol combined together. So most men are ignorant because they say like life is short, you know, lazima nikunywe nijibambe, you know, understand that people say. So most men are ignorant about the causes of prostate cancer and its consequences. Yeah.
Zingine kunaweza kosa ile awareness, kuna mtu ajui prostate cancer ni nini. Pia kuna mtu amesikiaga tu ajai experience. Kuna mtu maybe imemuaffect experience. But nature ya man mara mingi tunaogopaga kwenda kwa madaktari. So unapata watu maybe hakuna mtu ana look forward kwenda kucheck hizo medical check up. So unapata maybe kama mtu ameaffectiwa ana realize ikiwa late.
People they have not been educated, they don't have the information. So mostly Kenyans have prostate cancer, but other than in Urogi or Akas, so they would go to the hospital. They deal with the traditional way. Watenda kwa mganga.
Yeah. I think only for the educated are aware about prostate cancer. But for most people in our country, most of them don't understand about prostate cancer.
Society currently is, let me say, they are favoring the opposite sex than men. So we find men are really disadvantaged because they don't get those opportunity to discuss such issues openly.
Let's say like girl is like the river and we boys are like the source, you know, like because without women, us men we need to be born, and us women also, us men I mean, we take advantage of women. So I don't think most people assume that girls are just more important than boys. But in the real sense, women are more than men, so we should concentrate more on men than women. Because if I'm much like today, so in today's morning's broadcast, out of 10 newborn babies born every day, you'll find out of 8 girls are born and 2 will be, let's say, 2 boys. You understand? So the rate of women are high than men. So me, I think we concentrate on the male child than the female child because they are large in number.
Some in studio, those are some of the opinions that I've sampled here on the street. Now back to you to continue with the interview.
and welcome to the program. It's Health Tuesday on this 10th day of October 2017. My name is Samuel Njoroge, and today we're focusing on the prostate, cancer of the prostate, otherwise known as prostate cancer. It is said that it is one of the leading causes of deaths related to cancer in men. And the question is why? And of course, there's that whole issue of it's a taboo topic. Yes, we're still African, and we will consider some of these discussions taboo. There's also the lack of awareness. There's also the ego factor to consider. But again, I've got panelists in studio this morning, and they're going to give us more information on prostate cancer. One, we shall get to hear from an oncologist in terms of what prostate cancer entails, and we shall hear from a urologist who is going to tell us how to exactly take proper care of our prostate. My name is Samuel Njoroge. The hashtag is Good Morning Kenya on Twitter, and 22162 is the SMS line. Begin with the initials GMK. Ask any kind of question you have on this topic. It's October, it's Cancer Awareness Month, and therefore let us have these conversations to avoid any loss of deaths. Allow me to, any loss of lives, I beg your pardon. Allow me to introduce my panelists in studio this morning. To my immediate left, I've got Dr. Gladwel Kiarie, who is a physician first,
yes,
then an oncologist.
Yes.
Thank you so much for coming with over 14 years of experience.
Yes.
Thank you so much and welcome to the program. And I've got Dr. Gitobu Mburugu, who is a surgeon first, then a urologist, also with 14 years worth of experience. Karibuni sana to the program. I'd like to begin with you, Dr. Kiarie. What is prostate cancer?
Thank you, Samuel. Let me begin by saying that cancer is abnormal growth of cells. Our bodies are very well regulated. Cells grow for a reason. They have a standard dividing time, and there is a programmed cell death. You know, when they do their work, they die off. Now, cancer happens when that controlled cell growth is interrupted, and you have abnormal growth. And this abnormal growth can occur in all parts of our bodies other than the hair, the teeth, and the nail. So the prostate gland, which is a gland just below the bladder, that is used by the body to produce certain fluids that are used in the process of reproduction in men, can also become cancerous or malignant, especially as men grow older and some of their cells change.
All right.
Yes.
Dr. Gitobu, what can be described as adequate prostate health?
Basically, that's a difficult question, Samuel. But like my colleague said, the prostate produces fluid that about 1/3 of the fluid that a man ejaculates comes from the prostate. And contrary to popular belief, very little comes from the testes. It's only about 5% that comes from the testes. So every time a man ejaculates, part of that comes from the testes. I mean from the prostate.
A third.
A third of that.
Yes.
So it has been postulated that regular sex is good for the prostate because it keeps the secretions flowing, so to speak. But diet-wise, because probably that's what you're asking, a healthy diet, I'll always say what is good for your heart is good for your prostate. So a healthy, regulated diet, cessation of smoking, reduction or cessation of alcohol intake. There is a compound called lycopene,
yes,
which are found in watermelons and tomatoes. It is said to be good for the prostate. Vitamins like vitamin E and vitamin D and vitamin A are said to be good for the prostate. The compound zinc, which is found in some foods, is also good for your prostate. Too much red meat is probably not good for your prostate. Like we said, what is good for the heart is good for the prostate.
Yes.
Because studies have shown that people from Southeast Asia, whose diet traditionally was very low in meat and high in soya, which is a vegetable, had traditionally very low prevalences of prostate cancer. And when these people migrate to the West, within 2 or so generations, they catch up because they assimilate the diet of the West, which is meat-rich.
Yes.
Their cancer prevalences catch up with the locals in the West. So all that has been postulated. History of sexually transmitted infections in your youth might probably, not proven, but might probably contribute to cancer as you grow older. So avoiding getting urethritis, chlamydia, or gonorrhea might be in your good interest. So in a nutshell, that is what would contribute to good prostate health.
Okay. So in a nutshell, embrace a Mediterranean diet.
Probably.
Probably.
We don't have olive oils in Kenya, but yeah.
And wanaume wakule watermelon na nyanya.
In moderation also, of course.
It's
We're not saying that they should eat that alone, yeah.
Before I cross over to you, Dr. Kiarie, let me clarify something.
Yes.
Because you did mention regular sexual activity,
yes,
frequent ejaculation. In the course of researching for this, I came across information that on average, a man ejaculating 21 times a month is good for the prostate.
There are many studies out there which are not probably very conclusive. For every study that says regular ejaculation is good for your prostate, there's another study that says the opposite, because like we said, the history of sexually transmitted infections can lead to prostate cancer. So regular ejaculation might mean that you're more exposed to maybe infected partners. So like you said, it's a balance. As long as you're having regular protected sex, then that's okay.
That's okay.
But not just regular sex.
Not just regular sex. Yeah. That's good to clarify. Dr. Kiarie, why is it that testosterone fuels the growth of cancerous cells?
Now, you know, probably let me just quickly add on the risk factors.
Okay.
People concentrate too much on these issues of diet, probably because it's the only thing that they probably can change. But it's such a balance because probably your genetic predisposition and the risk factor of age, you know, change of the cells, which you really cannot control through eating a lot of tomatoes and carrots, you know, the red things with lycopene that Daktari talked about. It's such a delicate balance that you may not prevent yourself from getting prostate cancer by eating the right diet. So Daktari is right. One of the things that we must encourage is regular screening, because you may not prevent it by the lifestyle Daktari has described, but you must diagnose it early. You must diagnose it early. Now, testosterone is very important in the development of prostate cancer. Testosterone is a male hormone of masculinity. It fuels the growth of the prostate gland. And in fact, it has been hypothesized that in races or ethnicities where they have higher levels of testosterone, the rates of prostate cancer are also higher. In the same vein, where regular sexual activity may be protective, promiscuity, multiple partners, polygamous relationships also predispose men to higher risks of prostate cancer. So it's a very delicate balance with sort of contradictory studies. So what are people left to do is actually, maybe I cannot prevent myself from getting prostate cancer, but I can find it early. So higher levels of testosterone are associated with growth of the gland. And that also is associated, probably, they say that Afro-Americans, especially in America where they can compare Afro-Americans to Caucasians, are thought to have higher levels of testosterone and therefore higher incidences of prostate cancer, more aggressive disease, and presentation at earlier ages. And this is also thought to be in Asians and Hispanics as compared to those we would call Caucasians.
Caucasians, yeah.
And that is why some of the modalities of treatment we shall discuss are actually aimed at reducing your testosterone level. In 1967, a man won a Nobel Prize by discovering that if you block testosterone, you reduce prostate cancer, or you cause regression of growth of the prostate gland. So they started this by doing what we call orchidectomies. So testosterone is produced by the testes as well as other sites in the body, but mainly the testes. So they discovered if you removed the testis gland,
Yes.
then the prostate gland grew smaller and prostate cancer actually regressed. And it is one of the greatest discoveries in our time. We call it castration because you remove a man's masculinity, his potency, and probably his fertility. And that sometimes treats their prostate cancer. Now, as medicine has evolved, the treatment has come from surgical castration, removal of the testes, to what we call chemical castration, which we can reverse. So you don't permanently remove the testes, as Daktari would do for you, and that's, we refer to urologists to do that. But we can also use drugs to reduce your testosterone or chemically castrate you. But when we stop the drugs, your potency is, retrieved, and you become fertile and potent again. So that is a more, more used modality of treatment because many people want to undergo treatment for interval periods of time. Prostate cancer is a highly curable disease, which is, you are very right, Samuel, when you said it's one of the commonest cancers in men in Kenya. And is also one of the ones with the highest cause of morbidity or suffering and mortality.
Dr. Gitobu, coming to you, research indicates that men in their late 40s to their 50s should get regular screening of their prostate. Someone may then wonder, what exactly changes with the prostate over time?
Okay. That's a good question, Samuel. As a man grows older, the prostate expands. It grows bigger. This is a normal phenomenon for every man. As you grow older, it expands. A normal prostate is between 15 to 25 cc's. And then as you pass your 40s...
When you talk of cc's?
Cubic centimeters.
15 to 22?
15 to 25.
15 to 25 cubic centimeters.
That's a normal prostate.
That's a normal prostate.
So, for example, yours would be probably that, since you're a young man. And mine would probably be much bigger than that.
All right.
So, a lot of people will not notice this. But in a few people, they might notice changes with their urinary pattern. So, either you cannot hold your urine like you used to, or you go to the loo and people come and leave you there because you're peeing so slowly, or you find maybe you're wetting yourself because you cannot reach the toilet before you let go, or you find that you're waking up at night many times, or you find that after you've stopped passing urine, after you get the feeling that your bladder is empty, and you zip up and go away, you feel like you need to go back and pass more urine. So all these are signs of an enlarging prostate. And that is normal. As everybody grows older, their prostate becomes larger. Now, only a few people whose prostates are enlarging will get cancer. Not everybody whose prostate is enlarged has cancer. So we have to differentiate the two, an enlarging prostate and cancer of the prostate. So once you get to about 40 to 50, it's a good idea to see a urologist for your first prostate check. And in this, we do two things. The reason why men are a bit hesitant to see a urologist is because one of these things includes examining the prostate by inserting a finger into the back passage, because that's the only way you can feel the prostate in a living person. So
the back passage, you mean?
The rectum.
The rectum,
yes.
through the anus?
Yes. So that's why most men are a bit hesitant to visit us, because it's part and parcel of the examination. The other thing you can do is a blood test called prostate-specific antigen. So this is a chemical test. Prostate-specific antigen is a compound found in the semen that causes the semen to be a bit thicker once you ejaculate it. Now, if you have cancer of the prostate, this compound leaks into your bloodstream and is found in higher amounts than you would expect. It's always there in the blood, but in little amounts. But if you have cancer, these amounts go higher. So if you, then the doctor does a digital rectal examination, as we call it, of your prostate, and feels an abnormality in the prostate, maybe an area of roughness or an area where it's a bit more swollen than the rest, and then your PSA might be a bit higher, then the doctor may recommend that you undergo a biopsy. A biopsy involves putting a needle into the prostate. It sounds painful, but it isn't all that painful. And retrieving small amounts of the prostate through a needle, which the pathologist then looks at and tells us, is there cancer or not? And if there is cancer, what grade of cancer is it? So the first of such tests, the blood examination and the digital rectal examination of the prostate should be done between 40 and 50.
Between 40 and 50 years?
Yes, when you're the age of 40 and 50. And then thereafter, you can have probably it done every 1 to 2 years.
Okay.
A caveat here is for people who have a very strong history of, a family history of prostate cancer. So if your father died of prostate cancer or got prostate cancer in his 50s, or then probably one of his brothers also had prostate cancer in his early years, then his sons and your cousins, male cousins, should all be screened a bit earlier, maybe from 40.
From 40.
It's not very common to find cancer of the prostate running in families, but it is there. So the ones at risk, if your father got prostate cancer when he was in his 50s or even earlier, then you should be screened in your early 40s. Yes.
I'm in my mid-20s.
Yes.
Should I go for a prostate examination?
No, you don't need a prostate examination in your 20s. But that having been said, one of the complications of sexually transmitted infections is something called prostatitis, infection of the prostate, and it happens in young men, and it's a very painful condition. So if you find yourself in that position, then of course you need to have your prostate examined, but as a matter of routine, you don't until you're in your 40s to 50s.
I'm sure this is the catch-22 situation in this, with this interview. My fellow age mates will capture the part where they're supposed to have regular sexual activity, but then forget they'll be very selective in terms of what they want to consume.
Take away from this, yes.
The signs and symptoms of prostate cancer, Dr. Gladwel, which ones are they?
Now, you know, saying signs and symptoms of prostate cancer means that the presentation of urine symptoms, because as Dr. has described, the prostate gland encircles the little tube that comes from the bladder to take urine out. So as you grow older and that gland grows bigger, it compresses this little tube that takes urine out. So as you grow older and gets bigger, the stream of urine gets a little closer to you. And also, a lot of urine is usually retained when men go to the toilet, try to pass out urine. And they take long, and there's a lot of retention, so there's post-micturition dribbling. There's what we call hesitancy. To start to pass urine gets a little difficult. All those symptoms of benign enlargement may also be symptoms of prostate cancer. But as Dr. has rightly said, most of the time, these urine symptoms are actually just because of the normal benign enlargement that is not cancerous. But because you can't tell the difference, that's why it's good to have your first urology visit. Now, when you have that visit and the doctor examines you, and again what the doctor has described is the location of the prostate gland just below the bladder, encircling the urethra that takes urine out, but also very close to the rectum, is the other reason why we do a digital rectal exam. So the second symptom may be when the urologist, when you go to see the urologist, because you're having a problem with your urine stream, and he does a digital rectal exam, is finding the rectal mucosa, or the rectal wall, is a little attached to the prostate gland. They have ways in which they can be able to tell that this is not a normal exam or this is a normal exam. Then follow up to that physical exam, we do what is called a transrectal ultrasound. That means that we put an ultrasound probe to the backside and we can see the prostate gland very well, and then you're able to see whether that growth is normal or abnormal. And that also helps the urologist using that probe to be able to direct where the biopsy is actually going to be done. And they do it very well. They'll take several specimens and this is taken to the laboratory. Before that, as Daktari has said, after you have your digital rectal exam, as he's planning your ultrasound, he also does the test we call the PSA, or prostate-specific antigen in your blood. We have a normal amount which we say is normal for certain age groups. So if you're 40 to 50, we expect your PSA level should be this. If you're 50 to 60, we expect it should be this. But because individuals vary, if you've had a first visit, normal visit to see your urologist, in about 3 years, if your PSA rises, say, from 2 to 10, we call it PSA velocity, or from 2 to 20, because of the monitoring, Daktari may know, wow, this PSA velocity or change is not normal.
Right.
And therefore, an ultrasound or biopsy is actually indicated, even if you're 60 and the range should be normal.
Yes.
They actually investigate because they know your individual PSA. They've been following you up, so they know when you have a sharp rise, and therefore they should investigate. And that's why Daktari is saying an initial visit is very good to guide how your follow-up is going to be. Is it in 3 years? Is it in 2 years? And the time that they notice an abnormality, they are able to investigate you, make a diagnosis early, and probably cure you of your prostate cancer.
Right.
Yes.
Let's separate myth from fact, and I'd like to begin with you. Daktari, what are some of the myths associated with prostate health?
There are many. There are many. All of them, most of them circulate around sex, like we said. So if you have too much sex or if you have very little sex, people say that's how you get prostate cancer. Some will even say you're cursed. Some will say it's transmissible, that you got it because of an infection that you had. All these are the myths, like we said. So no one really understands what causes prostate cancer. No one really understands why some people get it and others don't. And we are just beginning, like Terry said, we are just beginning to understand the treatment of prostate cancer. Nothing much has changed since 1967 when they realized that castration can reduce the cancer burden in a man suffering from prostate cancer. But things are advancing slowly. So there are those myths, but like we said, we don't know much about what causes it or what doesn't, or what protects you from it.
Okay.
Yeah.
Is it true that your choice of dressing, both for your trouser and your innerwear, can directly affect the health of your prostate?
No, no. It might affect the health of your testes, but not that of your prostate.
So we also need to get the difference
of
prostate and testes.
Yes.
Please clarify for us.
So the prostate gland is among what are known as the male accessory sex glands. So this includes the prostate gland, which is just below the bladder inside the body, inside your pelvis. It includes another gland just behind the prostate called the seminal vesicles, which is what most of your semen is. Most of your semen comes from the seminal vesicles. It includes some glands found along the urethra, and then it includes your testes as well. So the testes are the two male organs that hang in the scrotum. And they're in the scrotum for a reason, because for you to form sperm in the testes, they need to be at a lower temperature, slightly lower temperature than the rest of the body. And that's why the testes drop from the body just before you're born into the testes, so they can be at a lower volume, at a lower temperature. So if you wear very tight clothes, that might increase the temperature in the testes. If you take long saunas and these things that people do in the gyms, saunas and steam baths,
and everything.
Yeah, that might also increase, reduce your sperm production slightly.
What of hot water?
As long as it's not for prolonged periods of time, it's not bad.
Okay.
Yeah, what is bad is prolonged exposure to high temperatures. Yes.
Okay.
Yes.
You know, Dr. Gladwel, we hear that maybe cancerous cells can shift from one place to another. Does this also apply to the prostate? Can it be a victim of cancerous cells transmitted there? And can it also trigger transmission of cancerous cells to other parts of the body?
Definitely, Samuel.
Yes.
When we mentioned that cancer is abnormal growth, one of the characteristics of cancer is that it can metastasize or spread to other parts of the body. The rules of cell growth usually regulate that the cells of the eye remain in the eye, the ones of the bone remain in the bone. They don't grow into other organs or infiltrate, and they don't spread to other parts.
Right.
But cancer doesn't obey those rules. So prostate cancer cells will grow and infiltrate. For example, they'll come from the prostate gland, they'll break through the capsule or the covering, and they'll infiltrate the rectum.
Right.
Some people come to hospital because they are bleeding from the backside. And when we investigate, we actually find it's not a cancer of the rectum, it's actually a cancer coming from the prostate, growing all the way back to the rectum. So it, just like any other cancer, prostate cancer can infiltrate or grow into other organs. Some of the prostate gland cancerous cells will infiltrate the bladder, and sometimes people will present with blood in urine or blood during sexual activity because it has grown into another organ, and now, you know, when it infiltrates, there is break of the mucosa and there is bleeding. Then it can spread to other places, and one of the areas that the prostate cancer cells have a predilection for is bone. So many of the times when we find prostate cancer, one of the places we look for spread is actually bone. And unfortunately, when we talked about prostate cancer, morbidity or suffering,
Yes.
many men will come with low back pain, difficulty in walking, even cord compression, because of prostate cancer that has spread to the backbone. So it can spread to the bone, it can spread to the lung, it can spread to the liver.
Exactly.
And this is because if it's not detected early, it's not controlled, it will metastasize.
Dr. Gitobu,
Yes.
psychosocial support to those suffering from prostate cancer is very, very vital.
It is, yes.
How can ladies play part in this war against prostate cancer? How does a lady support their man who is suffering from prostate cancer?
Ladies can play a very important role in this. Like we said, it is a daunting experience for a man to visit a urologist.
Yes.
And spouses will probably be the first to notice the change in this urinary system, or rather change in urinary habits of this man. So they will notice that he wakes up too many times at night, more than he used to. One of the things that early prostate cancer does also is it can cause a sudden loss of your erections because it infiltrates the nerves that cause erections. So, of course, your spouse will be the first to know this. If you've been previously potent and suddenly it goes down, there might be a problem there. It's not the only cause of that, but it's one of the causes. And like we said, a lot of men are shy of going to the urologist, and it takes ladies, the spouse, sometimes to bring the man to hospital.
Literally.
Literally. And it is the lady who will actually give the history, the information to the doctor that, oh, he gets up too many times at night. Oh, he can't hold his urine when we are traveling. Oh, he's
lost his erection.
Exactly, he's lost his erections, or maybe he's ejaculating blood, and so on and so forth. So ladies play a very important role in encouraging men to seek medical attention for their prostate and other conditions as well, and that is commendable. Yes.
Dr. Gladwel, diagnosis of prostate cancer. Let's walk our viewers through the process. I know the biopsy was mentioned earlier, but let's just walk through the diagnosis of prostate cancer.
Forgive me, Samuel. Can I say another psychosocial support?
No problem. Go ahead.
You see, when we discussed treatment, we use chemical castration or surgical castration. So probably one of the support factors will be understanding that one of the consequences of the treatment, you know, many side effects are individual, but, you know, where it involves lack of potency, lack of fertility, it's probably a two-way traffic for their spouses to actually be understanding and supportive and reassuring that this is actually not significant. And that goes a long way in helping the men or their husbands go through the treatment. Coming back to diagnosis, now the process of diagnosis is that the urologist will have followed up a patient, pick up that the PSA is rising, send them for the ultrasound, do a PSA, do the biopsy, and then refer the patient to an oncologist. And what we as oncologists do is actually what we call staging. So there are several things that we look at. The biopsy that Daktari will have ordered and the report is brought to me, there is what we call grading. How aggressive is this disease? And there is something we call Gleason Scoring, which is actually very important in how we determine the management. So we may look at the Gleason score, and depending on how high it is, with the primary and secondary pattern, we may give recommendations about what to do next. Surprisingly, we don't treat all the prostate cancer we find.
Right.
People with a very low Gleason score, a low PSA, we sometimes do what we call watch and wait. Because some of that prostate cancer will actually regress and never become anything substantial or worth treating. But that's a very small sort of group.
Yes.
So when we look at the Gleason score, we do what we call staging. And staging means exactly what you had asked, that prostate cancer can spread to other parts. So we do a bone scan, we do imaging of the pelvis to look at the relationship of the prostate with the rectum and the bladder, and basically what is the extent, determine what is the extent of this disease. Because the approach to cancer is that you must address everywhere the cancer is. So for example, when we get the stage, we cannot recommend surgical removal by Daktari if we find there is already involvement of the bone. Because even if you remove the prostate gland, the disease has already spread through the blood to the bone. So you need to address it in a wholesome way. And unfortunately, because of the late presentation, either because of our, social and cultural factors, the fact that prostate cancer has sort of a reproductive association, late diagnosis is sort of the feature of disease in 3/4 of patients, both with access to diagnostics and those without, access. So that would be sort of the diagnostic procedure and appropriate referral. Do I refer to a surgeon?
Yeah.
Do I refer to a radiation oncologist? Do we start medical management using chemical castration to reduce the disease and probably do what we call palliation? Because advanced disease is not curable. But I must encourage patients here to say that prostate cancer advanced disease is one of the most sensitive diseases to treat because it responds to hormonal therapy.
Yeah.
So the treatment will be easy. It will be chemical castration by doing what we call androgen deprivation, but it's definitely, majority of the times, the response is actually quite good to palliate or to prolong survival.
And it's good that we accept that it can get a bit intrusive.
Yes.
It can get a bit intrusive. You spoke about grading. Is this what is usually T0 to T4?
That is staging.
That is staging.
That is staging. TNM is basically a stage. And T means what is the size of the tumor within the prostate gland.
Yes.
Like, for example, if we call it T3, it means that it's actually, grown to a certain extent within the prostate gland.
To both lobes.
Yes.
Yeah.
And T4, I see you've read up. And T4 means that there is actually break of the capsule and probably extension to the fat and to other organs. Then N deals with the involvement of lymph nodes, and M is for metastases. So T and M is staging.
All right.
What is the disease extent?
Okay.
Which is very, very important to establish before you begin to manage the patients.
And at that point, I've got a question on T1 before I cross to Daktari. T1 means that it is only within one lobe and not
very
both.
Early disease.
And very early.
Yes.
Does it mean then that you can remove one testicle, remain with another? What does that mean?
You see, Samuel, now you're confusing.
Yes. Prostate and testes.
Now, you see, if you have T1 disease, we won't even bother with your testes. Because in the prostate, it means that it's very early disease and very tiny. That means either we can do what we call prostatectomy, removal of the prostate without touching the testes.
The testes.
Remember, Dr. said that the prostate is within the body, just below the bladder, in the pelvis, and the testes are outside the body in the scrotum.
In the scrotum.
But the testes in the scrotum outside the body produce testosterone, which causes the prostate gland to grow bigger and for prostate cancer to progress. So we can remove the testes to treat the prostate. We can block the production of testosterone to treat the prostate. So T1 disease, we don't touch the testes. We actually concentrate on the prostate gland because it's very early. Either by locally treating the prostate by surgery, radiotherapy, surgery, and targeted radiation, we can actually cure the patient. Yeah.
So it would be proper to conclude through your explanation that the testis becomes a victim of the prostate. But the issue is never the testis, it's the prostate.
Yes, but it's like saying which is the chicken and the egg situation because the testis becomes the victim of the prostate, but the testis is the one that proliferated the prostate, in the first place.
In the first place. Yeah. Very good point to note and to clarify. Dr. Gitobu, this can get extremely intrusive, as you mentioned. The exam, getting the fingers through the back entry, in examination and everything, when you go to the biopsy, yes, it may not be as painful, but it's very intrusive. And in some cases, you need between 12 and 24 needle biopsies.
Yes.
How does a man come to terms with this? How do you prepare a man to go through this entire process, including the diagnosis?
So one of the most important things that doctors should do is learn how to counsel patients or clients. When a man walks through and says he wants his prostate examined, or maybe he has been referred because his PSA is rising, or maybe somebody has examined his prostate and thinks it's abnormal, then you need to sit down and talk to him about the things that you aim to do.
Yeah.
A urologist can tell with some degree of certainty, even before the biopsy is done, that most likely this is prostate cancer, depending on the examination and the PSA. So you need to sit with him, counsel him that we are going to do a biopsy. The biopsy may reveal cancer. If we find cancer, then we have to stage the cancer so that we see if it is advanced or spread or it is localized, like Dr. said, because the treatment of the two is different. If it is within the prostate, I can cure, or rather it can be cured. If it has already spread out of the prostate, then it's not possible to cure, but you can control it, like with chemical or surgical castration. So the man has to know what he's coming in for. It has to be, it's sort of like when you go for an HIV test, like the counseling that you get. It's the same counseling that patients who are facing the prospect of cancer should get before you have examined and diagnosed it, so that they know what the journey entails. You don't want surprises, oh, go for a biopsy, then you come and say, oh, sorry, you have cancer. And yet you did not tell me that this biopsy might tell me that I have cancer. So that is why counseling and the ability to empathize with patients and walk with them along that journey is important.
It's very important.
It's very important. And also there is a cost aspect. Treating cancer, like Dr. will tell you, is not one of the cheapest things. So there's also the cost aspect. They need to be prepared in advance to know that it will cost this much to do this, it will cost this much to do this. Can it be done locally? Do you have to be referred to the national hospital? Do you have to be referred outside, or whatever the case may be? So, so it is important to counsel patients well in advance.
They say too much of anything is poisonous. Is there anything like over-screening?
Yes. Yes. In a few years ago, I think in 2000, a body that deals with screening in the United States came up with a statement that said that screening is not encouraged for prostate cancer. Unfortunately, they had based this statement on a flawed study. which had shown that people who had been screened did not fare any better than people who had not been screened. But several other studies came out after that, soon after that, that showed the exact opposite, and they were better done studies. So to some extent, yes, you should not screen everybody. For example, let me give you an example. If a 70-year-old man who probably has hypertension, diabetes, already has cardiac disease because of these two conditions and therefore will not live for very long, comes to you, it is probably futile to start looking for prostate cancer because he'll die of something else before the prostate cancer kills him. That having been said, it is the right of the patient. It is the right of the patient to know if he has prostate cancer or not. So and it is also the right of the patient to refuse screening if he's offered, because it may bring in things that he did not want probably to know. But all in all, screening saves lives.
And information is power.
And information is power.
And information is power. Dr. Gladwel, your final word, largely touching on treatment and the discussion that we've had this morning.
Yes, what Dr. has said is actually very right. I think my take-home message should be that, you see, we usually adapt what we say depending on our circumstances. Over-screening may not apply to us because we have not even begun screening. Men don't go to hospital to have a digital rectal exam, whether they are the right age or not, and they don't do PSAs. So for our setup, and prostate cancer is killing our people, and we are making a diagnosis in over 70% of the patients when it's too late, and the prostate cancer will kill them. So it is very important to get checked in our circumstances, make an early diagnosis, and aim for a cure. Now, I would put what Dr. has said a little differently. And I hope as our health services improve, and you know, Dr. will also concur that we've come a long way, for example, in managing hypertension and diabetes, and even cardiac disease. You know, in these conditions, when we have access, patients can actually live for very long. And like I said, prostate cancer is one of the diseases where when you have advanced disease, you can actually palliate patients for many years, you know, putting them on multiple lines of treatment. You know, radiate them this year because they have bone pain, put them on bone medicine, androgen deprivation therapy. You know, Dr. is also very right that nothing much has changed, but many drugs have been developed in this modality of blocking androgens. If you get resistant to this, we change to that. And we can keep you alive for many, many years. Even with advanced disease.
Thank you, Dr. Gladwel, Kiarie, and Dr. Gitobu Mburugu for coming to the studio and sharing information related to prostate cancer. Honestly, guys, among your feedback is that between 15 to 24, Samuel pick a score. I got you right. But thank you so much for watching the show this morning. That has been info on prostate cancer. We shall continue the discussion as and when we get time. Enjoy the rest of your day, and God bless you all abundantly.